Hello, thank you for joining us today. We are really glad you're here. Here's Jim, your host of Time Out with Jim. So let's get started.
And will it get better? What is anxiety? It is an emotion characterized by an, a, a feeling of uneasiness and worry, usually generalized and unfocused as an overreaction to a situation that is only subjectively seen as menacing. It is often accompanied by muscular tension, restlessness, fatigue, and problems in concentrating. Anxiety is closely related to fear, which is a response to a real or perceived immediate threat. Anxiety involves the expectation of future threat. Anxiety disorders differ from developmentally normative fear or anxiety by being excessive or persisting beyond development appropriate periods. They differ from transient fear or anxiety, often stress induced by being persistent, typically lasting 6 months or more. Although the criterion for duration is intended as a general guide with allowance for some degree of flexibility and is sometimes of shorter duration in children. Anxiety is distinguished from fear, which is an appropriate cognitive and emotional response to a perceived threat. Anxiety is related to the specific behaviors of fight or flight responses, defensive behavior or escape. It occurs in situations only perceived as uncontrollable or unavoidable, but not realistically so. Another description of anxiety is agony, dread, terror, or even apprehension. Fear and anxiety can be differentiated in 4 domains: duration of emotional experience, temporal focus, specificity of the threat, and motivated direction. Anxiety can be experienced with long, drawn out daily symptoms that can reduce quality of life, known as chronic anxiety. It can be experienced in short spurts with sporadic stressful panic attacks, known as acute anxiety. With me, the first sign I get that I'm having an anxiety attack is I get a metallic taste in my mouth, and it's god awful, nasty taste. And then I start feeling my heartbeat faster, and when it first came on, it would make me hyperventilate all the time. I would go from anxiety attack to a full-on panic attack, and I had to be put in the hospital a couple times for it. I'm on medicine for an anti-anxiety medicine, and it does pretty good. I, I still don't like big crowds, especially inside of places like going to Walmart or grocery store or whatever, or even people's homes, even with my family. I love my family to death, but if there's a big crowd like during Thanksgiving or Christmas or any other time, and there's more than 10 to 15 people, I gotta take me a pill. But outside, I'm okay with having a lot of people with around me on the outside, but they can't all be like squishing me in, like, give me some space. I'm like, give me some space. Okay, symptoms of anxiety can range in number, intensity, and frequency. At some point in their lives, most do not develop long-term problems with anxiety. Anxiety may cause psychiatric and psychological symptoms. The risk of anxiety leading to depression could possibly even lead to an individual harming themselves. The behavioral effects of anxiety may include withdrawal from situations which have provoked anxiety or negative feelings in the past. Other effects may include changes in sleeping patterns, changes in habits, increase or decrease in food intake, or increased motor tension. Now this picture right here is what it really does feel like you're getting squished. Like the walls are caving in. You could probably call that claustrophobic too. Me in the elevators, no, I can't do that. Going into walk-in closets, just rooms like that, I cannot do. No. The emotional effects of anxiety may include feelings of apprehension or dread, trouble concentrating, feeling tense or jumpy, anticipating the worst. I do that all the time. Irritability, restlessness, watching and waiting for signs, and occurrences of danger, and feeling like your mind's gone blank. Yeah, that's true. The cognitive effects of anxiety may include thoughts about suspected dangers, such as fear of dying. You feel an intense fear when you think of dying, or you may think of it more often than normal, or can't get it out of your mind. When I thought about starting a podcast and a YouTube channel, my anxiety had a lot to do with it. I was like, I don't know about this. So if you go back to my earlier videos, I wasn't doing really well. I got through it. I posted it, but I'm working through it. I guess this is why I'm doing these, is to get my self-esteem better, my get out of my head, get out of try to control the anxiety. And also I got depression, and it keeps my mind busy for that also. Instead of me sitting around watching TV or taking a nap all day in bed, and I'm thinking, oh, poor me, I'm depressed. With my depression, I mean, I don't have to have any specific reason to be depressed. I mean, my depression can come on just like that. Well, let's finish this. The symptoms of anxiety. Neurological, like headaches, paresthesia, fasciculations, vertigo, or presyncope. I tell you, they make some difficult words to pronounce. Digestive as abdominal pain, nausea, diarrhea, indigestion, dry mouth, or bolus. Respiratory as shortness of breath, or sighing breathing. Cardiac, like palpitations, tachycardia, or chest pain. Muscular, like fatigue, tremors, or tetany. Cutaneous, like perspiration or itchy skin. Frequent urination, like going to the bathroom more than normal. Dyspareunia, I hope I said that right. Impotence, and chronic pelvic pain syndrome. With anxiety, you can have all these. You panic, you could worry, scared, trembling, pacing. Medical conditions can cause anxiety. This includes conditions that affect the ability to breathe, like COPD, I have COPD, and asthma, and the difficulty in breathing that often occurs near death. Conditions that cause abdominal pain or chest pain can cause anxiety and may in some cases be a somatization of anxiety. Conditions that affect the face or the skin can cause social anxiety, especially among adolescents. Rigidity, I cannot say that word. Inflexible problem solving, denial, avoidance, impulsivity, extreme self-expectation, negative thoughts. I do that a lot. Effective instability and inability to focus on problems. Anxiety is also linked to perpetuated by the person's own pessimistic outcome expectancy and how they cope with feedback, negativity. And I cannot, oh, if I get any kind of negative feedback, I know with YouTube I'm going to get some. When I do get some comments, I am still fairly new, but I know there are people that will give me bad feedback, and that's okay. But once it's okay now. But when I see it, it's gonna get to me. I'm going to try not to let it happen, but I know it will. Temperament and attitudes have been found to be risk factors for anxiety. Psychological. Cognitive distortions such as overgeneralizing, catastrophizing, mind reading, emotional reasoning, binocular trick, and mental filter can result in anxiety. Those who have high anxiety can also create future stressful life events. These findings suggest that anxious thoughts can lead to anticipatory anxiety as well as stressful events, which in turn cause more anxiety. Psychodynamic theory posits that anxiety is often the result of opposing unconscious wishes or fears that manifest in maladaptive defense mechanisms such as suppression, repression, anticipation, regression, somatization, passive aggression, and disassociation. While psychodynamic therapy tends to explore the underlying roots of anxiety, cognitive behavior therapy has also been shown to be a successful treatment for anxiety by altering irrational thoughts and unwanted behaviors. Treatment. The first step in the treatment of a person with anxiety symptoms involves evaluating the possible presence of an underlying medical cause whose recognition is essential in order to decide the correct treatment. Anxiety symptoms may mask an organic disease or appear associated with or as a result of a medical disorder. Cognitive behavioral therapy is effective for anxiety disorders and is a first-line treatment. CBT appears to be equally effective when carried out via the internet. While evidence for mental health apps is promising, it is preliminary. First-line drugs are the selective serotonin reuptake inhibitors, or SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs. Benzodiazepines are not recommended for routine use. Other treatment options include pregabalin, tricyclic antidepressant, buspirone. I tried that buspirone. It didn't do nothing for me. Maclobebine, maclobemide, maclobebine, and others. And that is going to be it for anxiety. And remember, materials contained on here are for informational use only. The content is not intended to be a substitute for professional advice. Diagnosis or treatment. Seek the advice of your doctor or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it. If you think you may have a medical emergency, call your doctor or 911 immediately.
If this episode touched you in any way, please share it with your family and friends. And please consider donating whatever you can afford. Go to anchor.fm/Time Out with Jim. This will help us keep the podcast going. Thank you for listening, and until next time, God bless.